I'm Martina Tierney, Occupational Therapist and Clinical Director at Seating Matters. As occupational therapists, we work every day to improve the functional ability of our clients. As part of my work at Seating Matters, my aim is to improve the functional ability of our clients while seated. This is the reason I set up Seating Matters in the first instance, because I could see the devastating negative impact that poor sitting was having on the functional ability of clients in nursing and care homes in my own area. So what is function? Function can be divided into three areas: activity-related function, physiological function, and psychological function. Activity-related function may be getting into a standing position, reaching for a glass of water, reading a newspaper, or feeding themselves. After careful assessment and the provision of specialised seating, a person's physiological function should be improved. This will include respiration, swallowing, digestion, elimination, and circulation. Psychological functions are very important for our patients. We sit for many reasons. We sit to talk, relax, work, or watch TV. First of all, the client needs to have a stable base of support. The client may also require postural support while seated. For example, the use of lateral supports or headrests. The use of tilt and space also facilitates a good functional position. The chair must be the right size. If a chair is too wide, it will encourage a pelvic obliquity, which will impair function. If the seat depth is too long, it will encourage a posterior pelvic tilt, and this will impact on breathing and on function. It is important while seated that we accommodate tight hamstrings, so feet must be loaded. So the height of the chair is very important in order to improve function. It is essential that the back angle of the chair accommodates the hip angle of your patient. This will reduce the risk of sliding from the chair. It will reduce the risk of the client sitting in a posterior pelvic tilt and therefore improve their functional ability in the chair. There are some things we should become aware of which will reduce a client's functional ability in the chair. One of the common postures we see is a client sitting with their arms crossed in a chair. This is usually because the chair is too wide, the armrests are too low, and therefore the client has nowhere to rest their arms. They need to stabilise their body, so they fix themselves by crossing their arms. This then reduces their functional ability. If the client maintains this posture for a long period of time, they lose the ability to feed themselves, take drinks of water, or to communicate. Another common posture we see are clients sliding out of the chair and using their feet to hold them in the chair. This is usually caused by a seat that's too high, a seat depth that's too long, or a back that's too straight. This posture will reduce the client's functional ability in the chair. This posture often causes pressure ulcers on the heels, which in turn reduces their client's ability to weight bear. Loading the feet is an essential part of any seating assessment. Not only does loading the feet reduce pressure ulcers, but the client also likes to feel the sensation of grounding, and this will help to improve their functional ability in the chair. During our research, one of our clients had a very severe kyphosis. This restricted his ability to communicate, to swallow, to breathe. The unique features of the Phoenix chair allowed the kyphotic posture to be completely supported, and by using 45-degree tilt, we were able to improve his breathing. He was able to feed much easier, and his swallow had improved. During our 2-year research project with Ulster University, our chairs were proven to improve the functional ability of our clients. For example, there was a 49% reduction in postural correction. This meant that there was a reduction in the number of times a client had to be repositioned. This obviously improved their functional ability in the chair. One of our goals as occupational therapists is to have our clients seated for as long as possible throughout the day in a functional position which is comfortable. During the research project, we found a 13% reduction in time spent in bed when a client was properly assessed and a chair provided. One of the main goals of seating is for the client to be comfortable. And during our 2-year research project, we found that there was a 40% decrease in pain medication while properly seated. This obviously led to an improvement in function and an increase in the time spent in the chair. These are just some tips to help you achieve maximum functional independence for your client while seated. However, a seating assessment is essential. All our seating specialists have been trained by me, so contact us today to book in your free seating assessment.